Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN. Healthy world, healthy nation, healthy you. I'm Nancy Valentine, PhD and registered nurse. And this show is dedicated to you, the healthcare consumer. And our show today is talking about a very worldwide disease, heart failure. So the title of our show is Getting to the Heart of Healthcare Costs. Heart failure, and we're going to be speaking about heart failure and Medicare costs. And let me tell you a little bit about the prevalence of heart failure. Heart failure is a very major disease, both here in the United States and worldwide. It is a very costly disease to treat, primarily because so many people wind up rehospitalized. And in fact, getting rehospitalized is one of the things that our government, through Medicare, is really looking at and really working with hospitals to decrease those hospitalizations. But we're going to be talking with you today about the role you play in helping to decrease either having heart failure to begin with, or if you do have heart failure, how to decrease your rehospitalization. And we have an excellent guest with us today, and I'd like to introduce you to Dr. Barbara Riegel, who is a wonderful expert worldwide on this topic. And let me tell you a little bit about Dr. Riegel. She is the professor of nursing and the Edith Clemmer Steinbright Chair of Gerontology at the University of Pennsylvania School of Nursing. She is also the director of the Biobehavioral Research Center there. And the focus of the research center is to really get knowledge organized around the interaction of biological and behavioral factors in the promotion of health. And she's going to talk with you about that today, translate what that really means. She is an established nurse scientist studying adults with cardiovascular disease. And her focus is self-care of older adults with heart failure. And her interest grew out of the work that she did many years ago as a clinical nurse researcher at the Sharp Healthcare Institute in San Diego, California, where she performed some of the very early work in heart failure disease management. So I think we should start with that, Barbara. First of all, welcome. Thank you for being with us.
Thank you so much for having me, Nancy. This is really an honor. I'm pleased to be here.
Well, we're equally honored to have someone of your caliber with us today.
Thank you.
But I think that would be really interesting. When you said that you have done some of the seminal work, meaning the early groundbreaking work in management of heart failure, tell us what that means.
I had the honor of working as a clinical nurse researcher at Sharp Healthcare in San Diego for a lot of years before I came to the University of Pennsylvania. And in that role, we set up disease management programs, which are basically ways to choreograph the way that different providers come together and script the care for people with particular illnesses. But it was during those experiences, and we tested all sorts of different models on the telephone, in support groups for people who were Hispanic. We tried a lot of different approaches, but the thing that kept getting my interest was this idea that it was really self-care that was going on, that they were with us, the patients were with us for a short period of time, and then they would be home taking care of themselves.
Right.
And so it's really all about self-care.
Right. Well, I think that's a really interesting point. First of all, I want to point out to our viewers that that's what she, as a clinical nurse researcher, was looking at. She was actually studying and collecting data and information to see which intervention worked the best. You know, was it patient education? Was it having an interdisciplinary team? Really, what was it that was going to make the difference in really getting people to follow their medical regime? And so you said that really the more you focus less on the professional disciplines,
Yes.
obviously they play a critical role, but really more about the patients, the individual, the caretaker, the family.
Exactly.
What sort of came through with all that? I mean, above and beyond the obvious, like you said, they're really in the healthcare system for such a tiny piece of the action. They're home after that. Really, what was the missing link?
The missing link. I wish I could tell you that there was one missing link. we did begin to look at it in terms of these phases of maintaining health, trying to get people to take medications, follow a low salt diet. It's sort of kind of the basic everyday kind of behaviors. But then there's really a much more complex piece of it where patients need to get very involved in monitoring themselves and not putting their head in the sand when they start to get symptoms. So what we found actually over the years is that there are these almost phases as people get diagnosed with heart failure. In the beginning, there's some emotion, oftentimes some anger, or some maybe even denial. And people cheat a lot on the diet or the medicines or the different things that we ask of them. And then there comes a period of time where they start to get hospitalized, and then they become very serious about these issues, and then oftentimes it's too late. Because once someone with heart failure begins this trajectory of being hospitalized, then you have to be very serious about self-care to stay out of the hospital. And so I've always thought, gosh, if I could get somebody's attention way up front, that would be so exciting if I could do that and get someone on this trajectory of just kind of keeping everything in balance.
Right. Well, that's certainly an important goal for everyone involved. First of all, if you have heart failure, or you know someone who does, or you have a friend or a neighbor, these are the kinds of things that you want to impart to them from this show, because really prevention is the key. But what I'm hearing you say is it's hard to get people's attention early on in the illness. So what happens often in a healthcare organization, whether it's the doctor's office or if you have been in the hospital or you're going to a clinic, people are telling you what to do. You must do, this, you must do that, you must increase your exercise regime, you must eat less salt, you must do, all kinds of things. But it sounds like people don't necessarily hear it.
I don't think any of us want to hear those things. If we're feeling good, we really don't want somebody telling us what to do. But let me go back to a comment you made about prevention, because I actually also want to make the point that right now we're looking at heart failure as this very common illness in older age. It's common in the United States. It's common throughout the world. It's common in developing and developed countries. Right. But that is kind of the final common pathway of some things that you've all been hearing about all of your lives. Control your blood pressure, get physical activity, avoid getting diabetes if you can, keep your weight normal, all those things that we're told over and over and over again from our young adulthood. And then the two most common causes of heart failure, which is this final common pathway of the heart not pumping well. It's a very unfortunate term, but that's kind of what we're stuck with. But the two major causes are high blood pressure and a heart attack. And so if you think about it, these are things that we think of high blood pressure occurring at all ages, especially with the epidemic of obesity that we're seeing. And so it's that chronic high blood pressure that can often lead to a heart attack. And even if it doesn't lead to a heart attack, it can lead to heart failure. So those two major causes, a heart attack and high blood pressure. So prevention is really the name of the game, and it can start early.
Right. Well, we could have a whole discussion on that, unto itself. But, really, we're talking about the back end of this primarily today, and that is we have so many people that haven't paid attention to that and who really do have a heart attack or have had chronic high blood pressure that wind up with heart failure. And the question is, how are we going to control this, not only for the quality of life of the individual, but also the runaway costs? When all the healthcare reform has been enacted, over a period of time, it's been gradual leading up to this. Heart failure was really targeted as the number one expense. So if there's anything that's really contributing to the national debt from a health perspective point of view, that you as a consumer could really play a role in helping to nail down, and that is try not to have heart failure to begin with, that's obvious. And the second is, if you do, how to control it so that you do not have to go back in the hospital, because it's really a double-edged sword at this point. You know, it's very expensive for you, even if it's just co-pays and hospitalization charges, but it's going to be extremely expensive for hospitals because they are going to be disadvantaged if you come back, especially if you've been in the hospital and return within 30 days. The hospitals are going to pay a penalty for that rehospitalization. So suddenly they don't want you back any more than you want to go back. And that's part of the focus of this discussion. And that is, what role are you going to play? So let's go back. I just want to make one comment in terms of the term heart failure. Unfortunately, my father did not have high blood pressure, but he did have a heart attack. And when he was hospitalized at one of the local hospitals, to be unnamed, the big banner over the entrance of this unit was, "Welcome to the heart failure unit." And I looked at that and I said, couldn't you come up with something a little more upbeat? I mean, this is depressing. Welcome to the heart failure unit. I mean, we're hoping that when people go through these doors, they're coming back out with some level of increased wellness. But I think it's, again, one of those disconnects between the jargon that we get involved in and not looking at it from a consumer perspective, because as a nurse, I certainly understood what heart failure meant, and I certainly understood that was the unit that he was on. But I was seeing that as the consumer, and it was like, I don't want to go to the heart failure.
Yes,
unit.
I don't want to fail.
I don't want to fail.
Yeah,
right. I want to like at least try to be upbeat.
We could talk for an hour on that topic. Let me just comment quickly to say that it's unfortunate that we have the name. We're stuck with it. Some providers, believe it or not, will say to their patients, well, you have an illness where your heart isn't pumping too effectively. Well, that's nice. It certainly couches it in a nice description of heart failure. But when that patient then goes home and gets on the internet and tries to find heart not pumping effectively, sort of like if you would just say the name heart failure, that person can get a wealth of information about their illness and learn how to take care of themselves better, because we're not going to change the name.
Right. So are you saying that through your research that a lot of people just don't connect if they do have high blood pressure and they're obese?
Yes.
And they're not eating a very balanced diet. They don't sort of like understand that that is a link to a very serious illness.
I don't think that there's a lot of discussion that goes on about heart failure in general. Elizabeth Taylor died a few years ago, and she died of heart failure. And everybody said, oh, isn't that unfortunate? Elizabeth Taylor, everybody knows who she is. But I thought at the time, great, heart failure will get a little bit more attention, and it didn't at all. So I don't think people, they sort of see it as, well, you know, you have to die of something, and you're going to die when you're old. But that's not a happy way to die. This is not a pleasant scenario. Let me go back to the hospitalization issue.
Okay.
1 in every 4 people are readmitted to the hospital. After you've been in the hospital, 1 in every 4 people come in within 30 days. And half of all people who have been in the hospital for heart failure come back within 6 months. And once those hospitalizations begin, in 3 years, about 50% of people are dead. So the whole trajectory of feeling so poorly that you have to come into the hospital to begin with, let's prevent it like right there. Let's just prevent that first hospitalization with self-care. If you learn that you have heart failure, it's this issue of getting on a program where you're taking your medicines pretty regularly, following a sensible diet that we're going to talk about next, and then just trying to keep everything in balance, monitoring for symptoms, because there are a lot of symptoms, and if you ignore them, they will get out of hand and you will be in the hospital. But if you pay attention to them, then you can probably prevent a hospitalization, and that's what it's all about.
Well, I think that's very important. Let me just stop and really underscore that point. The point of this show, Dr. Nancy RN, is really to have this dialogue with you, because with healthcare changing so rapidly, the way it is really impacting you is as follows when we're talking about heart failure. When people had heart failure, you know, in the past, so to speak, which is not that long ago, before all the reforms and the financing has changed, people and in hospitals were happy to see you come to the hospital. I mean, they were happy to see you come, and I mean, we'll take care of you, we'll get you stabilized. And I think we as consumers really didn't have a whole lot of knowledge about how we could take care of ourselves more effectively, and we're, you know, happy to at least have that kind of help and service. But now, with healthcare reform changing, it really does require that you have more skin in the game, as people will say, meaning that you have more investment in your own self-care and your own prevention, because hospitals are not going to be as welcoming. I mean, they're certainly going to welcome you if you come to their door, but they have a financial mandate to really help you stabilize more quickly and not come back, because they are financially beholden for their reimbursement. Now, you could say, okay, that's really bad, you know, we shouldn't have healthcare reform, except it is reality. And what Barbara is telling us is, if you pay attention and you can connect the dots, as she is helping us do today in this discussion, you can avoid that hospitalization. And that is really, in the whole scheme of things, a good thing. Most people do not want to be in the hospital. They would rather be able to take care of themselves more effectively at home, and really only save that hospitalization if it's truly necessary. If everything else has not worked, you've done everything that we're prescribing for you from a self-care perspective, and if it doesn't work, then obviously you have to be seen at that next level of care. But we're talking about the level of care that people can control effectively themselves. So tell us more about that. We've talked about prevention. So if you are overweight, your physical activity is low, you know that you have high blood pressure or borderline high blood pressure, which give us the numbers.
140 over 90.
140 over
Lower
90.
is better. Lower is
Okay.
better.
Under 140 top number, under 90 bottom number. Bottom number is actually more important in some ways than even that top number, but you don't need to know the fine points of that. Just less than 140, less than 90. Then
Diabetes.
diabetes, you know, that's another risk factor. You must take care of it, because if not, you're looking at heart failure. It's just a matter of time.
It's just a matter of time.
You're not going to, like, you know, sort of like swerve around it. You're going to hit it head on. You know, it's just a matter of time. And I think you've made the point. It's not a pretty illness.
No,
so tell
it really
us
isn't.
about that.
So the symptoms of heart failure are distressing. So there's a lot of shortness of breath with it, a lot of fatigue, a lot of poor quality of life. What we're recognizing fairly recently, the last couple of decades, which is fairly recently in an illness perspective, is that there's a lot of confusion and memory loss. So we have a lot of cognitive issues going on. And so you can imagine what it feels like to not really be able to, I mean, to get to that point in the illness that you can't really remember things, you can't, you don't feel well. And so good in the very beginning when you still feel pretty good, lots of depression, I didn't mention that one. So when you're still feeling pretty well, it's good to get on a regimen that is sort of routine for you, because as it progresses, you really want to move into what I like to call body listening, where you're really paying attention to yourself regularly. We ask patients to get on a scale at the same time of the day. You know, like after you've emptied your bladder, you get up in the morning, you empty your bladder, you weigh yourself. You're not measuring to see whether or not you ate too much yesterday. That's what I can still remember a patient saying to me years ago, "Oh, honey, that's a bad habit to get into." But it's not about weighing yourself for eating too much. It's about water weight. It's about retaining fluid. And so that's really what you want to be paying attention to. You want to be listening to your body. Am I retaining fluid? Am I a little bit more fatigued today than I was yesterday? Am I a little bit more depressed than I was yesterday? A little more confused? And maybe even keeping some records where you're monitoring yourself over time, bringing that into your physician or nurse practitioner, and you know, paying attention to where you are. We just recently completed a study where we looked at what happened before people were hospitalized and how long they delayed. And we found that one of the things that was very related to delay was taking a wait and see approach. That doesn't make it with heart failure. You don't get symptoms and then say, well, I think I'll wait and see if they'll go away. It doesn't work like that. So you need to be monitoring yourself routinely so that you pick up those symptoms quickly, and then you call your provider and say, I'm more fatigued than I was yesterday. I've gained 3 pounds just overnight. I think something's wrong. And when you become proactive like that, the provider then will have some things that they can offer to you just over the telephone. Oh, take an extra water pill. Call me if your weight is not better tomorrow. Where you really get involved in this self-care, you take control.
Right. So you have to know your numbers. You know, we talked about the blood pressure numbers, but you have to know your weight numbers. And I think that the prompt about weighing yourself, keeping a little chart, same time every day with the same amount of clothing on, that way you know that you're getting a clear measurement. And even a couple, 1 or 2 pounds, you have to monitor that because that is putting more pressure on your heart to pump and only making it worse. So it's, I want to be sure that we're not giving people any point of confusion. So if, for instance, they are monitoring but things aren't going well, that wait and see approach, like you said, is not a good idea.
Not a good idea.
But they don't necessarily have to go directly to the hospital. No. The next point is call your provider.
Call your provider, unless you're so short of breath. And then I would say, gosh, next time could we monitor a little bit more routinely so that you don't get, so it's not a catastrophe that you have to go to the emergency department. That's what we're seeing. We're seeing people are slowly gaining weight, slowly getting more short of breath, taking a wait and see perspective. Oftentimes there's a spouse in there saying, oh honey, just lie down, it's sure to go away. And so we have this folie à deux going on in a couple. Instead, if everybody's sort of proactive about this, where you caught it early and then you say, oh gosh, I have gained 3 pounds, I'm going to call my provider.
Right. So the body listening is really being self-monitoring, but it's also taking action.
Yes, yes.
So you're listening in order to take action.
Yes, and so what you've done, Nancy, is that you've beautifully outlined this process of maintaining yourself in a healthy state, monitoring for changes, and then being active about those changes, treating those symptoms quickly when they occur.
So that's really the outline of self-care.
That's the outline of self-care.
Self-care is all about.
That's what it's all about.
And if you are able to do that, you are a great partner to your nurse practitioner or your physician, whoever is your primary treater. You are really helping them and they are helping you. So it's really not something where they are some mysterious force that's going to get you out of the woods when you run into problems. It's like you're working together and you're getting yourself out of the woods and they're happy to help you. It's a different relationship.
Very different, very different.
So when you, back to your research, when you found out that really self-care was the name of the game, it seems like, you know, people often say, you know, don't tell me what to do, tell me how to do it. So are you helping teams to figure out how to help their patients better?
That is exactly, I mean, you've just quoted it perfectly, and that's another quote actually from a patient long ago saying, you know, stop telling us what to do and tell us how to do it. And so what oftentimes in hospitals, in settings, you'll meet up with a nurse or a physician who'll say, oh, you have heart failure, you need to do this and this and this and this and this. You need to follow a low sodium diet, you need to get the scale every day. And sometimes I see patients kind of checking out as if there's this talking head and they're not really engaging the patient. But what the patient really wants to know is, well, how do I follow a low salt diet? Well, I need to weigh myself. Exactly how should that look? How should I do that? Or else we're just leaving patients to come up with their own trial about what's going to work for them. We need to engage people in a discussion about what's going to work for you.
Right.
Let me give you a concrete example. We say to patients, we want you to get on the scale every day and weigh yourself. For a lot of patients, that really doesn't work well. And so instead I say, well, are your rings tight? Are your ankles swollen? And so there's this great graphic that we're going to put up of swollen ankles. You can monitor other things besides your weight if that isn't working for you.
So I think that what we were trying to do is translate it down to what regular people are going to pay attention to. And I think that that's a really good way of doing it. You know, weighing yourself is one thing, but knowing if your clothes are tight or your jewelry is tight, or like you said, you don't feel quite yourself that day. You have to really, you know, just take that seriously, and again, keep that self-monitoring going. So really, in terms of our takeaways today, we've talked about how you really want to prevent this illness to begin with by really taking great care of yourself now. And it isn't easy, like you said earlier. Nobody wants to hear about how they have to lose weight, how they have to do more activity. It's so easy to brush these things off and not make them part of your life. But you know, I was recently in the Scandinavian countries, just for a very short couple days, but it's amazing just the immediate difference that you see. Everyone's walking, everyone's riding bicycles. They have a whole thing where they just don't even lock up the bicycles because it's so enculturated. Everyone has a bike. So if they stop at a store, they just throw the bike on the ground. It's there when they come back because everyone has a bike. So I think that we have a culture where when I came back, you could immediately see all the overweight people in the airport. I mean, it is just so visually different because they have a different lifestyle. But we really have to start seriously taking on responsibility for our lifestyles. The second is how to really self-monitor. We've talked about what you need to do, how you really are able to do that easily at home. We haven't talked about telehealth and telemonitoring, but there are some tools that perhaps you will be able to have access to that can help you with some of this. But even without those tools, you can do much of this yourself. And we've also talked about how you play a very, very pivotal role in decreasing your rehospitalization. And that will be a tremendous contribution to your health and to the finance of healthcare reform, because these rehospitalizations for heart failure are among some of the most expensive hospitalizations. And by the fact that so many people have this illness, it really mounts up very quickly and is going to, you know, triple in the foreseeable future. So that's why Medicare is really focusing in on this, and that's why we're really focusing in on this today with you. So Barbara, any closing points you want to make?
Gosh, no, I think actually you've really covered it so nicely, Nancy. It's just such a common illness. I bet we all know somebody who has heart failure. I guess I would also say, in terms of preventing it, please go get your blood pressure checked right now and have your pass that word on to your friends and family.
Right. And you know, part of that is write it down. You know, when people get their blood pressure taken, so often they don't even ask their person who's taking it, who doesn't necessarily be a doctor or a nurse. I mean, many people are doing blood pressure screenings. Write the numbers down. Because you know what? I can even ask my mother, like, what's your blood pressure? Oh, I forget what the doctor told me, but it was fine. Yeah. Whether it's fine or it's not fine, I encourage her. Write the numbers down. That way you can have it in your wallet. You can, if you run into a problem, at least if you ran into an emergency room for something completely unrelated, that is important information for people to know what your baseline blood pressure is.
And we're talking about that because it's one of the major causes of heart failure.
Right. Yeah. Well, I want to thank Barbara for being with us, because I think what we've learned from you today, Barbara, is that there's all aspects of healthcare, and the role that Barbara has played on a national level is that by really working with teams and really helping teams of healthcare providers have a better understanding of the elements of self-care and really what goes into helping people take care of themselves effectively is a body of work and knowledge in itself. And I want to thank you for all the research that you've done over the years, helping all of us become much more attuned to really how to help the consumer. Thank you so much.
Thank you for inviting me.
You're welcome. Have a wonderful day, and please join us again soon. Thank you. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.